Hello everyone, I am Dr. Archana Daftardar. I am a nephrologist working at Renova Hospital, Kompally. As the summer is approaching, more and more patients, we see more and more patients with kidney stone disease or renal calculi disease. So this is also one of the common seasonal disease which is encountered many of the times. So what is the renal stone disease or the renal calculi disease? Whenever there is a stone formation in the renal, that is in the kidney tissue, it is called as renal calculi disease. So these stones can be small, they can be big, they can be anywhere in the kidney, ureter, bladder. This is all the urinary system. The chemical composition of these stones can be different. Commonly, calcium oxalate stones are the one which occupy most of the types of this stone diseases. This occurrence is almost 80%. 80% stones are of calcium oxalate, while the rest of the compositions are calcium phosphate, uric acid stones, cysteine stones, etc. Whenever there is a metabolic disturbance in the body, it leads to excessive excretion of the certain minerals and the salts, and then those salts get deposited in the kidney tissue and the stone is formed at that site. As long as the stones are inside the kidney and they are small, usually they won't cause any problem, any major problem to the patient. But as the size of the stone, the position of the stone, or the location of the stone varies, the symptoms also keep on varying. Let's see the symptoms of the kidney stones. The symptoms depend on the size and the location of the kidney stones. So pain, lower back pain on the sides, pain aggravating moving from the flank to the lower abdomen. This is the common site of the pain for the kidney stone, which is called as renal colic. And the second thing is about the urinary symptoms. There could be presence of excessive passing urine, that is increased frequency of the urine, blood in the urine, or inability to control the urine, which is called as urgency. Or there is a sudden stoppage of the urine because of the blockage which happens due to the stone getting obstructed in the way of the urine. So these are the various symptoms, and if the urinary system is obstructed because of the stone, then that may get infected, and then the symptoms of fever also can happen. Nausea and vomiting are another associated important symptoms. Let's see what are the risk factors for this renal stone disease. Usually, family history of stone disease is an important risk factor. Decreased water intake, high protein diet, in fact high animal protein, non-dairy based animal protein, that is increased intake of meat or red meat, is one of the major cause of the risk factor for the kidney stones. Unsupervised intake of the drugs like calcium supplements, vitamin D supplements, vitamin C supplements in excessive quantity also can lead to stone formation. There are certain diseases which can also be associated with kidney stone disease, like primary hyperparathyroidism, hypertension, gout, certain obesity, as well as some obese patients, they will undergo bariatric surgery, that is the resection or the surgically remove the bowel. So the stone formation, the risk of stone formation is more in such cases. Let's see what are different treatment modalities available for this. The treatment also depends on the symptoms, the size and the location of the stone. Symptomatically, if the patient is having severe pain, the pain relief becomes the major stay. If the size of the stone is smaller, then it can be treated medically by giving more fluids and certain medications to facilitate the passage of the stone. While there are certain conditions or situations when the stone size is more, they are bigger and less approachable, then that time there are some they need to be removed surgically. Let's see what can be done to prevent this kidney stone formation. Patients who are already having kidney stones should drink more water. They should seek medical help as much as possible, eat healthy, limit the weight, quit smoking, decrease oxalate rich foods. Which are the oxalate foods? Like spinach, excessive nuts, and potato, cashews are the one. And red meat needs to be avoided by these patients.